everybody. Thank you for coming. We are Team Luminary, and we're from Team Blue Light of Team 32. And today we have me, Lee, and I also have Kathy, and we'll be your presenters today. So we have a presentation on HIV versus COVID-19, a comparison of pandemics. So let's take a look at that.
Here's our first slide for HIV. There's a small video that will play here in just a moment to show you a little bit of what HIV is. Here's a small definition. HIV is a virus that attacks a body's immune system. If the virus is left untreated, it will lead to AIDS. And we will press play on this video.
HIV is the acronym for Human Immunodeficiency Virus. The virus attacks the human immune system, resulting in a chronic and progressive illness that leaves the subject vulnerable to infections. Once the body is unable to fight infections on its own, the pathology has advanced to the final stage of AIDS, acquired immune deficiency syndrome. The virus can't survive outside of the host body due to the temperature below 35 degrees Celsius. For this reason, HIV can't be transmitted through a handshake, cough, kiss, or sneeze. The virus must enter the body through blood, semen and pre-semen, vaginal fluid, spinal fluid, or breast milk. There are two ways to establish the presence of the virus, both requiring a blood sample. The rapid test is performed by piercing one finger and testing the blood right away, while the standard and most accurate test requires a blood sample that will be analyzed in lab and takes up to 2 weeks for the results. Both tests look for the presence of HIV antibodies and not for the actual virus. It can take up to 12 weeks for the antibodies to be generated. This means that an accurate result can be obtained only after that amount of time since the probable exposure to the virus. Remember, being HIV positive does not mean you have AIDS. Prevention remains our strongest weapon and has to be achieved through information, awareness and control. And even if a definitive cure is not available yet, medications called antiretroviral allow us to reduce the amount of virus in the bloodstream, preventing HIV from duplicating, spreading and reaching the final stage of AIDS.
What is COVID-19? Well, COVID-19 is a new disease caused by novel coronavirus. Most people who have COVID-19 have mild symptoms, but it can also cause severe illness and even death. Here is a video showing what is COVID-19.
In December 2019, China notified the World Health Organization of several cases of human respiratory illness, a disease later named COVID-19. The virus causing this disease is known as Severe Acute Respiratory Syndrome Coronavirus 2. The disease spreads through small droplets that are expelled from the nose or mouth when a person with COVID-19 coughs or exhales. Therefore, standing close to someone who is infected can put you at risk. These droplets can land on your hand and be transmitted through something as simple as a handshake, if afterwards you touch your eyes, nose, or mouth, the so-called T-zone. The virus is known to survive on different types of surfaces, so touching these contaminated surfaces and then touching your T-zone brings a high risk of infection. What we know so far: the coronavirus is spherical in shape, and its genetic material is encapsulated by different types of proteins. Some of the key structural ones are spike S protein, the most prominent feature of coronaviruses from where they get their name, then M, or membrane protein, and the so-called envelope protein.
Let's take a look at where HIV/AIDS first made their appearance and what scientists found. Scientists were able to detect the virus HIV-1 around the late 1940s to the early 1950s. In 1959, scientists collected a blood sample and found that a man from Kinshasa, Democratic Republic of the Congo, had HIV-1. This is the earliest known case to be reported. Then there were reports of developing illnesses from men who had had intercourse with other men. These illnesses were not found in people with healthy immune systems. This was during 1979 to 1981. Then scientists discovered AIDS in 1983.
Where did COVID-19 come from? Well, identifying the source is a bit tricky, but most researchers think the virus originated in bats. How it jumped to people is unknown. The earliest people diagnosed with COVID-19 had visited the Hunan meat and animal market. According to South China Morning Post, a 55-year-old individual from Hubei province in China may have been the first person to have contracted COVID-19. That case dates back to November 17, 2019. Scientists now suspect this coronavirus, SARS-CoV-2, originated in a bat and somehow hopped to another animal, possibly the pangolin, which then passed it on to humans. The disease is now spreading between people without any animal intermediary.
So, how does HIV and AIDS spread? They are transmitted through bodily fluids such as breast milk, blood, vaginal fluids, semen, so through unprotected sex, through childbirth, and needle sharing for drug use.
How does COVID-19 spread? COVID-19 most commonly spreads during close contact. Most common way the disease spread is through respiratory droplets, which can cause an infection when they are inhaled or deposited on mucous membranes. An example of this is like the inside of your mouth or nose. Another way is airborne transmission. Under certain conditions, this can occur in an enclosed space with inadequate ventilation. Also, contaminated surface can also spread COVID-19, but is less common. This occurs when respiratory droplets land on a surface. Then that person touches that contaminated surface, and then they touch their eyes, mouth, or nose.
As of November 25th, 2020, there are 38 million people living with HIV worldwide.
And as we can see on this slide, as of February 10th, 2021, there are 106,902,907 total reported cases of COVID-19 worldwide.
How does HIV affect the body? People may have flu-like symptoms, but not all do. The flu-like symptoms can last anywhere from a few days or several weeks, also known as acute HIV infection. And the possible symptoms can be fever, chills, rash, night sweats, muscle ache, sore throat, fatigue, swollen lymph nodes, and mouth ulcers.
How does COVID-19 affect the body? Exposure to the virus may cause symptoms to appear. This usually takes around 2 to 14 days. These are some of the symptoms someone with COVID-19 may experience, like lost, impaired or altered sense of taste or smell, fever, chills, or body ache.
Here's an example of a typical progression of HIV, starting with acute HIV infection whose symptoms appear 2 to 4 weeks after first exposure. Then it progresses to what is called a chronic HIV, and people in this stage of HIV can stay there for up to 10 years. The final stage of infection is AIDS. People with AIDS who don't take medication only live about 3 years, even less if they get a dangerous infection, but AIDS can still be treated at this stage.
This chart shows the typical progression of COVID-19. Once COVID-19 enters your body, you're infected by the virus. It can lead to being asymptomatic, meaning no signs of illness, or symptomatic, signs of illness. About 15% of cases are severe. This could be difficulty breathing with blood clots in the lungs or brain, leading the person being hospitalized. About 5% are considered critical and can lead to death. Lastly, about 40% of the cases are asymptomatic.
So here are HIV's effect on communities. People with HIV were called HIVers or positives, giving them a negative label. people with HIV had trouble finding jobs. Economy in countries that have lack of resources are in a decline. They're unable to keep up with the increasing numbers of cases with HIV, and the lack of resources to prevent the spread of HIV, such as testing and treatment, leading to more sick people and more deaths, making it difficult to create a thriving economy. Stigma, believing that only certain groups of people can get HIV, such as only gay men can get HIV. Before HIV was named by the CDC, the virus was called GRID, GRID, which stood for gay-related immune deficiency. Discrimination, excluding people with HIV or assuming people have HIV and treating them differently. Because of the negative stigma that HIV had and may still have these days, people who live with HIV are most likely to have a decline in mental health than those who do not have HIV.
COVID-19 effect on our communities are listed on this slide. Something that we learned is that there's an increase in mental health. What this means is that due to job loss, this is associated with increased depression, anxiety, distress, and low self-esteem. And we learned that it may lead to higher rates of substance abuse and suicide.
Here's a graph that compares the HIV infection rates of 2014 and 2018. As we can see, HIV mostly affects minorities such as Black, gay, and bisexual men, and Latino, gay, and bisexual men.
Cases and deaths for COVID-19 in the US. The first column to the left is the cases and deaths by age. As we can see, younger people are more infected by COVID-19, but are less likely to die from the virus. Although older people report less infections, they are more likely to die from the virus. On the right side of the column, we can see the cases and deaths by race and ethnicity. We also found out that although women are more likely to contract the virus, men are more likely to die from it.
In both COVID and HIV, people's mental health has been affected, especially those who have HIV and those who have COVID. So during this pandemic, researchers have gathered information, and we have it posted here on the slides. And this shows adult reporting symptoms of anxiety or depressive disorder during the COVID-19 pandemic. This is for the months of May, June, and July. And as you can see, there's an increase of adults reporting anxiety and depressive symptoms. People with HIV have a higher risk of mental illness compared to those who do not have HIV. And HIV sometimes can cause problems with movement, thinking, and emotions, and this is caused by HIV directly infecting the brain. Contact tracing for both HIV and COVID are very similar. Both track and inform others they've been exposed to someone who's infected, and give guidance to both cases and contacts for HIV. It's their partners. Both parties who have been affected by COVID, so the case and the contact, are given guidance for self-isolation or quarantine. For HIV, it's counseling and testing that's provided from a healthcare provider. Here are more similarities when it comes to HIV and COVID. Both we have never experienced before at the time and had to learn how to help communities slow down the spread. Both originated from an animal, which was then spread to humans. Both HIV and SARS-CoV-2 target T lymphocytes, which are cells that protect our bodies from infections. In the early stages of both pandemics, there were border restrictions that were placed. There were a lack of resources for lower income communities, and certain communities were targeted. So for COVID-19, it was the Asian community that was targeted, and for HIV, it was the gay community.
Now we look at the differences. HIV and AIDS is primarily transmitted sexually, and secondarily by needle sharing. COVID-19, on the other hand, is airborne by respiratory droplets or surfaces that have been contaminated. HIV infection is for life. Those infected are potentially contagious to others. where COVID-19 will show up anywhere from 2 to 14 days and continues if there's an onset of symptoms. HIV and AIDS has had no known vaccine. It is difficult to develop a vaccine because it's different from any other viruses, where COVID-19 has developed many different vaccines. Job loss during COVID-19 versus HIV epidemic. There was no reports found during the HIV epidemic. But for COVID-19, the country has lost 20.6 million jobs since mid-March, resulting in an employment rate of 14.7%, a level not seen since the Great Depression back in the 1930s. I want to thank you guys all for letting us present to you today. If you guys have any questions, feel free to shoot a chat message to any of our teammates that was in the beginning of the slide. Thank you again.